Joining us right now is a clinical psychology professor and director of Center for Community Research in DePaul's College of Science and Health. We have Professor Leonard Jason. Hi, Professor. How are you?
Good evening. Very good. Thank you, Ji.
So, you know what? We booked you last week to be on the show tonight. And I thought it was so great that you said, listen, I can actually speak to what's going on right now. So plain talk. I mean, I think it's common sense that we're already coming off months-long stay-at-home order on top of going through sort of the emotional and mental duress and, of course, also the physical toll for those as well that have been essential workers working through this. I mean, and on top of this, now protests and rioting and some of the other negative things that might be happening. I'm not talking about the positive, the rightful, lawful protesting is going on, but there is this big sense, so many people, of frustration and concern and worry and fear.
Absolutely. This is, as Bob Dylan said in his song, times are changing, and I don't think Chicago or the nation has really confronted something like this before.
And it's like it's compounding, right? Because of everything that we've been going through. And I mean, how do you deal with this on a psychological level?
So, yeah, I mean, we have the epidemic and we have the stress created by prolonged social isolation, restrictions in movement, cabin fever, stay-at-home orders, job loss of income. They all can really contribute to people feeling hopeless and even depressed. And that was a background for when people became sad and angry when watching and rewatching the video of George Floyd's murder. And his death was highlighted, and there was people that had justifiable outrage and frustration over police brutality. And it's recurrence. This has happened many times. This outrage also reflects the larger inequalities in healthcare, education, housing, employment that some of your guests on your program have alluded to that exists in our society. So yes, the demonstrations and riots are related to a lot of anger, depression over George Floyd's death and our society's racial inequalities.
And all compounded also by the COVID-19 pandemic as well. A lot more coming up with Professor Leonard Jason. And if you want to call, 312-981-7200 if you've got a question as well. But we're going to be talking a lot more with Dr. and Professor Leonard Jason coming up. Clinical psychology professor and director of the Center for Community Research in DePaul's College of Science and Health. And Professor, can you tell us what all that means? What does that mean to be the director for the Center for Community Research? And what do you do there?
Well, I'm very interested in kind of mental health issues. I take kind of what's called a public health approach. So I'm trying to think about how do we prevent problems? How do we basically extend services to those who don't have them? And how does one think about some of the longer-lasting solutions that are more structural? So, yeah, those are some of the types of things. And I have research going on in a variety of different areas, and I work very closely with community organizations and groups to try to bring about some of the change that you've been talking about on the radio today.
Wow. So can you describe some of what are you involved in right now that's really compelling in terms of your research?
Sure. Well, I work with recovery homes, which is where individuals reside when they're trying to deal with substance use disorders. If you can believe, there are more than 200,000 people living in these homes around the United States, and we have about 50 what's called Oxford House recovery homes in Illinois. Most people in these homes have had prior homelessness, criminal justice involvement, as well as psychiatric disturbances at some point. These individuals, as you can imagine, are at high risk for developing COVID-19. Mm-hmm. These homes are incredible settings that could provide our most vulnerable individuals safe places to live during this crisis. And we're working now to try to better understand how this large network of community-based houses is helping residents through this crisis.
Speaking of sort of these homes, and sometimes I don't know if it's correct to call them they're group homes as well, or and I lived in a neighborhood that had a lot of those, but then they eventually started closing down, and so folks went back to being homeless.
Yeah, clearly homelessness is not a very good place. So one of the things that you want to do is put people into housing that's kind of more permanent. One of the things that's really cool about Oxford houses, and that they're one of the large, big networks around the country. There's over 20,000 people living in networks of Oxford houses today. They're self-governing, self-run. There's no professional staff. They rent the house, and they live there as long as they want. You only have to do three things. You have to not take drugs or alcohol. You have to pay your fair share of expenses, which is about $100 to $130 a week. And you have to do the regular chores of the house. If you do those things, you can live in this house for the rest of your life. And these houses are all over the country. So just think about that community resource. And you know what's the best thing about it? They're self-supporting. They rent their own house. They pay for their own rent. They basically get jobs. And they basically support each other in their sobriety. So when you think about really trying to develop independence, this is where it's happening. And we know so little about these settings. And they could be a tremendous vehicle for change that's inexpensive, that's widely available, and that can help people from not only the things of homelessness and criminal justice involvement. By the way, you had someone from, the sheriff was talking earlier in your program. Do you know what people, when they come out of jail, say? They want two things, primarily: a safe place to live and a job. Mm-hmm. Do you know what happens when people come out of jail in prisons in our country? 600,000 a year. They don't have safe housing and they don't have a job. So what they end up doing is going back to the same neighborhoods that got them into trouble to start with.
Yeah.
So if you could give them, just again, it's a different way of thinking, and that's what a community psychologist does. I'm a community psychologist. I'm thinking about prevention. I'm thinking about systems. I'm thinking about hitting the root causes of problems, not just a Band-Aid approach.
Well, you were mentioning Ro Khan's interview with Cook County Sheriff Tom Dart. They talked a little bit earlier today during his show, and of course he's been a very, very outspoken about how much mental illness is involved in people that are in jail, and he feels shouldn't be in jail because they have mental illness issues that really need to be addressed.
Exactly. There's, in the 1940s and 50s, we've housed a lot of people with mental illness in state hospitals. And then we closed them all in the 70s, 80s, and 90s. So what did these people do from state hospitals that were there? They ended up on the streets. They ended up in nursing homes sometimes. They ended up in jails. So if you look at the population of jails and prisons, and you look at the population of mental institutions, the same number of people are institutionalized. It's just in different places. It used to be mental hospitals. Now it's in jails. Millions of people are in jails in our country. They don't need to be there. They could be someplace safer, someplace where they're learning new skills, where they're learning to get along with other people. And that's why a laboratory, a place where people can learn. So just think about how many people end up going into, to get released, they go to a single SRO, they call, they have a room, and that's it. And your best friend's your television set. Right. Is that really going to help that person?
No, I don't think so.
Yeah, so you want community. What we're talking about is how do we develop community for people that have been ostracized in some ways from it. We've got to bring them back into community. The way we do it as a community psychologist is to understand how people can get reintegrated back into neighborhoods and communities. And if we do that successfully, what happens is we get people stronger. Their immune systems get stronger. They become healthier. And they become less susceptible to these types of pandemics like we're being faced right now.
Speaking with Director of the Center for Community Research in DePaul's College of Science and Health, and he's also a clinical psychology professor as well, professor at Leonard Jason. So, of course, you were talking about as a community psychologist, what are your concerns right now? So we've got COVID-19, and on top of that, we have everything that's happening with this social justice movement and the protests. And then also the parts that, we have rioting, we have looting. There's a lot of people that are afraid and anxious.
So I think that I'm always thinking about what's not explored. And I think that this is a wake-up call for particularly African Americans and Latinx who are dying at very high levels from the COVID-19. Mm-hmm. And that should tell us something, that basically there's inequalities in our society, that those individuals who are dying, who have all types of risk factors, are in a sense risky because in some ways there's structural barriers. They're not getting health care that they need. They're not getting the jobs. They're not getting safe housing. They're not getting places where they can live that are safe. So if we think about how do we really address those structural inequalities, will basically help those individuals who are most vulnerable, and will also, in a sense, do something about the cries for help that these demonstrations and these riots are showing. So I think we have an unusual time now to really make this crisis an opportunity to change the way we're addressing some of these issues in a much more profound way. Sometimes a tragedy has to occur for us to really begin to sort of say, how do we make things better? And if we don't do it now, it's probable that something else will happen in the future that will basically even be worse. So now's the time to really address these issues, not later.
Well, it turns out that you also have researched sort of the long-term consequences of viral infections. What have you found in that research, and kind of explain that to us?
Okay, so about 80% of people who get infected with COVID-19 have minimal symptoms, and about 20% are going to get sick. Some of those people will require hospitalization, and a certain percentage will die, and that's unfortunate. But the thing we haven't talked as much about is that some of these individuals who get sick, who continue to live, are going to have long-term consequences of these viral infections. So I study viral infections and long-term consequences. I've been studying something called MECFS, which is known as chronic fatigue syndrome, for many years. And I'll give you an example of some of the research we do. The reason we're interested in this MECFS, chronic fatigue syndrome, is we think it's caused by a virus, and that people got a virus and then they don't recover. My colleague, Dr. Renee Taylor at the University of Illinois, and another colleague, Dr. Ben Katz at Lurie Children's Hospital, and I worked on a study about 10 years ago with mononucleosis, which is caused by the Epstein-Barr virus, and what happens to kids over time. And what we found was that, when kids get mono, something about maybe 2 years later, 4% are still sick.
Wow.
That's interesting. So after a viral infection, and you can go one infection after another infection after another. You've heard of the Spanish flu infection? Same thing. Mm-hmm. You can go every infection that basically has happened. A certain percentage of people, a small percentage, do not seem to recover. As you can see, the vast majority of people are going to recover from COVID-19 as well as from mono, but a certain percentage won't. They will continue to have different types of fatigue and other complications, and that's something that I study, that I'm interested in, so that we understand why is it, for example, that certain people get sick? Why is it some people get very sick? Why is it that some people seem to, in some ways, not only get sick, but get long-term sickness? And finding those predisposing, precipitating factors is very important to be able to identify, and that's some of the research that I'm conducting.
Well, that's fascinating. I had never even considered what the lasting effects of getting a COVID-19 infection would be, and now you've given me one more thing to worry about. Thanks a lot, Professor.
Well,
I'm kidding.
I know, but the thing I wanted to mention is that it's a small percentage. Right. But we have to be concerned that when someone doesn't get back into everything, the work environment and the social environment, we have to be very sympathetic toward them because it's not something they're making up. They're still sick, and we have to be sympathetic and caring about those individuals, because people with ME/CFS or chronic fatigue syndrome have lived in its existence for years, and they know what it's like to be stigmatized and isolated and not understood. And we don't want to have that same burden thrown to these people with COVID-19.
Well, thank you so much for being with us, sharing your thoughts on how, this COVID-19 pandemic has sort of compounded what's happening right now as well, in terms of the protests and the riots as well that are happening. And we appreciate you alerting us to, potentially lasting effects of COVID-19. So we'll be on the lookout for our loved ones who may still seem sluggish or as though that it's taking them. And we've heard reports where it's taking people a very long time, some people very long time to recover. So thank you so much for being with us, Professor. We really appreciate it. And we hope you continue to stay well. Okay.
Thank you.
Thank you so much for being with us. That was Professor Leonard Jason. He is the director of the Center for Community Research at DePaul's College of Science and Health. A lot more coming up right here on WGN Radio.